So thank you very much, Ulrich. And I would like to say thank you for inviting me. So we know each other for a long time in one of my capacities. One of the things I wanted to highlight is that the European Center for Primary Healthcare is not in Astana, is in Almaty. And if you remember the people in primary healthcare, the Alma-Ata Declaration, this is why the center is there. So now it's called Almaty. And one of the things I would like to share with you is this is a challenge because now I'm going to move from the hat that Trish had for more academic and British oriented, and I'm going to have a glimpse of what happens in the WHO European region that consists of 53 countries, going from Reykjavik to Vladivostok and from Tromsø to Valletta in Malta. So this is the challenge we have. But one of the things is that you can see in this slide on the left side and the right side two different products that the WHO at the global level they have produced. And on the left you see the operational framework for primary healthcare that is got some strategic levers but also some operational levers. And digital health is one of the levers in the operational framework for primary healthcare. And so my talk today will highlight the meeting point of primary healthcare and the digital health at the WHO European region. So as I said, at a global level, the WHO developed the strategy for digital health in 2020-2025, and this was endorsed by all the member states at the 73rd World Health Assembly. So all the participants here in this webinar, your countries, your governments, they supported this. And this is why it's relevant to bring this here, for not forgetting that there is the policy at the highest level. They tried to put this agenda forward. So in this as well, in the 2030 Agenda for Sustainable Development, highlights that the spread of information and communications technology and global interconnectedness has great potential to accelerate human progress, bridge the digital divide, and develop knowledge societies. So this is, but what we know is that digital transformation of healthcare can be disruptive. I would like to say that technologies such as Internet of Things, virtual care, remote monitoring, artificial intelligence, big data, blockchain, smart wearables, platforms, tools that enable data exchange, and all of those, plus what Trish said before, sharing of relevant information and exchange of data, and in this case across the health ecosystem, the important thing is that it should create a continuum for the patients. But at the same time, so far, they have proven the potential to enhance health outcomes. And in this case, primary healthcare is fundamental, and the role of primary healthcare is fundamental in the continuum of care. Another thing I would like to say that digital health can radically change health outcomes, but if it's supported by sufficient investment on governance of how the data is shared, institutional and workforce capacity. We talk about health literacy for healthcare professionals and health literacy for the citizens. And what we need for that is training, planning, and management where they are required, and at the context, thinking about the context, we are going to do that. So another thing that I would like to highlight here is that it's important to introduce the concept of the digital determinants of health. Those can be, as I said before, literacy in information and communication technologies, but at the same time, there is something about access. Not all the countries have access to equipment, to broadband, and access to internet. Even within the first, the high-income countries, there is a huge variability on access to broadband and access to internet. So this doesn't happen just in the low and medium income countries, but it also happens in the countries like the UK, as I saw about 3 or 4 days ago, Lincolnshire, that the broadband access wasn't so perfect in many places. So this is something that happens even in high income countries. So, but another thing I would like to bring here in this discussion is the appropriate use of digital health, and this could take different dimensions. And thinking about primary health care, we could think about health prevention and disease prevention. At the same time, patient safety, ethics. Sometimes we forget to talk about ethics, interoperability as an enabler, but at the same time, intellectual property, property, and then data security, like confidentiality, integrity, and availability. Privacy is another consent, and for the politicians, cost effectiveness also matters. But from the primary healthcare perspective, we should think about how we can engage patients better. No, and then the global strategy for digital health indicates that the digital solutions and the health technologies should be person-centered, trust-based, evidence-based, and effective, efficient, sustainable, inclusive, equitable, and contextualized. So for that, as you can see in the slide, in the framework for action, countries should commit to themselves to the implementation of the global strategy on digital health, taking into account the whole population. The most vulnerable should be included here. To catalyze, and catalyzing is creating this space for creation, as Trish said, that you can do some bottom-up approach in creation and innovation, but introduction, and then the opportunity to scale up the appropriate digital health technologies. Sometimes it's not right to scale up some technologies when the system is not ready. Then there is a must, and there is a must of measuring how the progress is happening and what the impact of these digital solutions are affecting the population or improving the health of the population. And then there is a process in the innovation processes. You have to enhance and iterate to create cycles of actions, to improve the solutions that are in place. So, and when we talk about from the WHO perspective, what are the general implementation principles? So there is one of the things we know that there is a growing need to implement appropriate digital technologies, but this should be in accordance to the health priorities and progress towards universal health coverage. That should be the goal. And in this example, this slide, you can see 4 objectives. One of them is collaboration and knowledge transfer. This is a great opportunity, this type of webinars. And the WHO, we are carrying out a number of webinars on this purpose as well. But at the same time, the digital strategies of the countries or subnational level, they should be implemented with some outcomes. So you have to have a vision. What do you want? A whole system approach. What is the specific development for primary healthcare in digital health? What are the outputs you need to introduce here? And you have to prioritize. So according to the context you live, then you should there are some policy and actions importantly here. So legislation, not all the countries have the same legislation, the infrastructures as well. And then you should target impacts. And finally, 2 more things. One is the governance of this information system, because when we talk about apps, when we talk about sharing information, the governance of this information is critical. But finally, the human-centered systems. The systems should be human-centered. Another thing I would like to do that, and this is the exercise that it's the challenge, is how to join the dots between primary healthcare and digital health. So I would like to go back to the operational framework of primary healthcare. This is a global framework and defined the strategic levers and operational levers, as I said, and digital health is one of them. So this is important to take into account, especially for the policymakers as well. So I would like to share with you, like Trish did before, some recent publications. So the WHO and the WHO European Observatory, they launched a publication. This is based on a comprehensive review of evidence regarding policies and their impact specifically in primary healthcare. The focus is primary healthcare. So the title, as you can see, is a primer on implementing the primary healthcare approach. And there are two chapters. One of them is on health technology, and another one is on information systems and digital solutions. And I was one of the co-authors of that. So this is something that I invite you to share. But some of the key messages in this premiere of evidence is that normally there are misconceptions of primary healthcare as naturally low tech. So, and this is something that this misconception is unhelpful. And I think Tree's example brought some of this into the discussion. So we know that technology has a huge potential to address some of the primary healthcare central concerns, like enabling diagnosis and treatments. But the important thing here is within the communities rather than in secondary care. The other things that it matters, especially for the health planners, is the possibility to understand the population needs, to support the person-centered service design. So introducing some new technology, some new digital solutions, you can redefine and redesign the service. Then another thing is to promote task shifting, and finally, to start working on competency sharing with non-professional cadres or patients that contribute better. And this is something that I'd like to introduce here, to accompany the patients in the service management and at the same time have the self-management of some conditions. And now I'm going to refer to another publication. This is quite recent in 2023 that my colleagues from the WHO Data and Health Unit of the European region in Copenhagen undertook. They undertook a journey of exploration and discovery. What they did is traversing all 53 member states of the WHO European region to take the pulse of digital health progress. What they found is a story of, first, transformation, resilience, and innovation. And the survey provided relevant insights into the current state of digital health in the WHO European region. So now for this discussion, I'm going just to give a glimpse of some of the dimensions explored in the survey. And I won't enter into detail. And what I'm going to invite you is to access to the document on the WHO website. And in this slide, you can start seeing that the national digital health governance, 83% of the reporting countries, 44 out of 53, have a national health policy or strategy. This is critical. The second one is that 98% of those 44 countries reported improving accessibility, quality, safety, and efficiency, and an equal number of improving health information sharing interoperability as a strategic priorities. In this slide, regarding access of sharing of data, all member states have passed privacy legislation, but 46 out of 52 report having implemented secure identification of patients and healthcare providers. So as you can see, not all of them still have this in place. Another thing that I'd like to do, if we move to electronic health records, I'm not going to read all the data in this slide, but I'd like to highlight that 87% of the member states report having either one, a national electronic health record, second, a system interconnected with regional electronic health records, or a patient record. So there are huge variabilities here among countries. In telehealth, 77% use telemedicine. And this is something that we are discussing today. So 39 out of 51 that responded to this question, out of 53 countries. So what happens with the others? So they are still quite behind. Some countries are behind on that. So teleradiology in 85% of the member states, and teledermatology around 50%, something that maybe some of our colleagues will explain later. And about mHealth and mApps, 67 have established mHealth services providing access to electronic health records, but only, and this is what's important, only 15% reported the evaluation of government-sponsored mHealth programs, not just devices, the programs that they were in place. So sometimes you developed a program and this is not evaluated. So this is something to take into account. And on big data and advanced analytic for health, I'd like to highlight that 60% of the member states reported having an overarching national data strategy regulating the use of big data and advanced analytics in the health sector. This is only 60%. And then one of the things I would like to do now is there is another publication, and it gives you an idea, and you can go in depth of some of the information on the digital health country profiles. So on the right side, you can see some of the dimensions that it was analyzed in this publication, the digital health country profiles. And I'm going just on for example, in this slide, you can see the situation of the countries in dimensions such as policies and strategies. And on the right side, the digital health technologies, electronic health records, and patient portals. You can see that on the right. The variability is huge, but the important thing here is how to learn from the ones that they are more advanced. And this is one of the exercises that from the WHO, it really matters. So this is a bigger image of the digital health technologies and in more detail. So at which countries have electronic health record at national level, another one at regional level. As you can see, there are varieties. Sometimes we have to make justice to the countries that they are decentralized, because some nations, some countries within the countries or regions, landers, they've developed specifically solutions that they are not captured at national level. So another thing is the same happens with health patient portals. And then the electronic medication prescriptions. This is something that you can see in this slide. Not all the countries in this slide, but I just took some snapshots of the publication. And the same happens with telehealth, as you can see in teledermatology, that it seems to be an easy solution. So not all the countries have this implemented. And telepsychiatry, the same, telepathology, telemedicine, and teleradiology. Those are examples that we can have from different countries. And finally, what I said, and this is the shocking thing, is the most relevant thing, is that monitoring and evaluation of digital health interventions is pretty low. Some countries are doing better than others, but this is where many countries have to make an effort. And then you could go as well. In these country profiles, you can click to each country and have a look an infographic format, all the aspects analyzed, and even a little bit deeper of that. So in this slide, for example, you can go to the electronic health records and see what is the situation in the health facilities with electronic health records. I put the example of Albania because it was the first on the alphabet list, but you can check your own countries or compare with other countries. And then at the same time, you can see the functionalities of the electronic health records and how these have evolved in these countries. And then on the right side, the similar things with the mobile apps. And now, another instrument that the primary healthcare measurement framework and indicators, this is something that I would like to bring into discussion. So this is another tool that WHO has provided, that it illustrates the monitoring progress across the health system with the traditional structures, inputs, service delivery, outputs, and this is done through the primary healthcare lenses. One of the important things here is that you can see in these indicators, you can, in inputs, you can introduce health information, but at the same time, you can monitor and do a cross selection of dimensions and develop some, and there is a display of potential indicators that you could link between health information, systems for improving quality, and then you can go to outputs and outcomes, and finally to the impact. So this is an excellent tool. Some countries are already testing this tool and with concrete examples. And finally, I'm going to explain from what we've been doing at the WHO European Center. We developed a framework to rethink integrated primary healthcare models and assess governments' progress in transforming primary healthcare. And if we use the subject as digital, so as you can see, I highlighted in yellow, you can identify there are digital solutions that they can identify the health needs of population. Some others, they contribute to the service development to effective response to these needs. Then these digital solutions, some competence have to be expanded thanks to the digital solutions. But then there is a question: how are we organized? How services are coordinated? And digital solutions contribute to that. And finally, as always, I want to remember, it's about performance and evaluating impact. And here you can see an example, a tangible example of a combination of digital solutions and transforming the model of care that was found in the region of Lapland in Sweden. And one of the things that transformed is through digital solutions, they were able to introduce new service models, so task shifting and roles of professionals. But at the same time, they empowered patients with self-management of patients, those patients that they live in those remote and dispersed areas. And a very specific thing is the telemedicine services nurse-led with the remote support of family medicine doctors. That's adaptation to the context, and that created a huge impact in outcomes. And then I think Therese also mentioned the concepts of the face-to-face at the facility is one of the components, but the remote delivery is something that contributes to advance the models of care and the service provision. And my last slide to conclude, among the high impact strategies to strengthen primary healthcare, there is one of them is the expand and deploy of digital health solutions fit for the health services, and is fit for the context. And I would like to conclude saying now is the time to generate evidence, and this is an excellent space for us to discuss and then to encourage all of you, because not just WHO, not just the academia, not just the policymakers, we still need to generate evidence on what works better and how to improve the service provision. So I would like to say thank you very much. And I'm here just to answer your questions as well. Thank you, Ulrich, for my introduction and the time.